You've been offered a medicine called Denosumab. This short video will show you how to draw up this medicine and self-administer at home. Denosumab is given to patients whose cancer has spread to the bones. The aim of this medicine is to help strengthen your bones, reduce any pain, and lower the risk of any bone fractures. This injection is given under the skin once every 4 weeks. Before you administer the injection, you will need to have a blood test to check your calcium levels. You'll be given a self-administration pack by the nurse. This will include a syringe, cleaning wipes to clean the Denosumab vial, a vial spike to draw up the Denosumab, a needle to inject the Denosumab, and a sharp spin to safely throw away all the used equipment. If, however, you have a carer who will be doing the injection for you, there will also be some gloves provided for you. So find a clean, flat surface to lay out all of your equipment. This could be a table, or it could be a tray that you've placed on the table. Use something that can be cleaned beforehand. So this is your Denosumab vial. We need to check the name of the drug, the dose of the drug, and we also need to check the expiry date. If the drug has expired, please do not use this and contact the hospital. Okay. First, remove the vial spike and the syringe from their packaging. Make sure that you touch only the middle section of the vial spike and the body of the syringe. Try not to touch the areas that connect to each other. Attach the blue end of the vial spike to the syringe. This will screw in place. Remove the cover from the Denosumab vial. This will flip off. Clean the top of the Denosumab vial with the cleaning wipe and let it air dry for 15 to 30 seconds. Remove the clear cover from the sharp end of the vial spike. Try not to touch the spike itself. Push the sharp end of the vial spike into the Denosumab vial. This will click when it is safely in place. Draw back all the liquid into the syringe. You may have to tip the vial upside down to get all of the liquid. Unscrew the syringe from the vial spike. Take the short orange needle out of the packaging. Take care not to touch the connecting parts. Attach the short orange injection needle by screwing the syringe into place. You may need to expel some of the air from the syringe. Dispose of the vial spike and Denosumab vial together in the sharp spin. Select an area of your tummy to administer your injection into. You can inject into either the right or the left side of your tummy. It should be about level with your belly button, in the middle between your belly button and your hip. It is a good idea to try and use a different side each time you inject. For example, if 1 month you used the left-hand side, try and use the right-hand side the month after. This is to avoid the same area becoming sore if it is always used. Pinch the area you are going to inject lightly between your thumb and your forefinger. Holding the syringe like you are throwing a dart and with the needle at 90 degrees, insert it all the way into the pinched area. Insert the needle firmly and in one movement. Push down until all the liquid has been injected. Remove the needle and cover it with the safety cover. Place the needle and the syringe into the sharps bin. You can wipe the site with some gauze or a clean tissue if you like. There is nothing else you need do. You won't need a plaster. You can have the Denosumab injection in your upper arm. This is easier if someone else, such as a family member, is doing your injection for you. The procedure for the injection is exactly the same. After each injection, partially close the sharps bin. Don't close it all the way until it's full. When it's full, close the lid all the way. You should hear a click. Once closed fully, you won't be able to open it again. When it is full, bring it back to the hospital and we can dispose of it for you. Your nurse can give you a new one at your next visit. You may also be able to arrange for your GP surgery to take the full bins. Make sure you know when your next appointment with the nurse or the doctor is. You will need to have a blood test taken 1 to 2 days before this appointment and before the nurse or the doctor can prescribe the next injection for you. Your doctor or your nurse will give you a blood card.